have not yet been able to recover from the outbreak of the coronavirus that is still spreading among us. In the meantime, another virus is spreading worldwide known as monkeypox. The World Health Organization has said another 50 suspected cases are being investigated, without naming any countries, and warn that more cases are likely to be reported. Infections have been confirmed in 9 European countries, as well as the US, Canada, and Australia. Monkeypox is most common in remote parts of Central and West Africa. It is a rare viral infection that is usually mild and from which most people recover in a few weeks, according to the UK National Health Service. Now, you might be thinking, what is that monkeypox? Where did it come from? In this video, we will talk about all of those things and more. Monkeypox is an infectious disease caused by the monkeypox virus that can occur in certain animals, including humans. But the incredible thing is that monkeypox isn't a new disease. The first confirmed human case was in 1970, when the virus was isolated from a child suspected of having smallpox in the Democratic Republic of Congo (DRC). However, monkeypox is unlikely to cause another pandemic. But with COVID-19 top of mind, fear of another major outbreak is understandable. So, how is it spread? The virus spreads in 2 ways, first from animal to human, and then from person to person. People, when they come into physical contact with an infected animal hosts include rodents and primates. People with monkeypox are infectious while they have symptoms, normally for between 2 and 4 weeks. You can catch monkeypox through close physical contact with someone who has symptoms. The rash, bodily fluids such as fluid, pus, or blood from skin lesions, and scabs are particularly infectious. Clothing, bedding, towels, or objects like utensils and dishes that have been contaminated with the virus from contact with an infected person can also infect others. Ulcers, lesions, or sores in the mouth can also be infectious, meaning the virus can spread through saliva. People who closely interact with an infectious person, including health workers, household members, and sexual partners, are therefore at greater risk for infection. The virus can also spread from someone who is pregnant to the fetus from the placenta, or from an infected parent to child during or after birth through skin-to-skin contact. Health officials are worried the virus may currently be spreading undetected through community transmission, possibly through a new mechanism or route. Where and how infections are occurring are still under investigation. So what will happen if the virus infected a body? After the virus enters the body, it starts to replicate and spread through the body via the bloodstream. Symptoms usually don't appear until 1 to 2 weeks after infection. Monkeypox produces smallpox-like skin lesions, but symptoms are usually milder than those of smallpox. Flu-like symptoms are common initially, ranging from fever and headache to shortness of breath. 1 to 10 days later, a rash can appear on the extremities, head, or torso that eventually turns into blisters filled with pus. Overall, symptoms usually last for 2 to 4 weeks, while skin lesions usually scab over in 14 to 21 days. While monkeypox is rare and usually non-fatal, one version of the disease kills around 10% of infected people, but if left untreated, it can cause more deaths. Treatment for monkeypox is primarily focused on relieving symptoms. According to the CDC, no treatments are available to cure monkeypox infection. Because monkeypox is closely related to smallpox, the smallpox vaccine can provide protection against infection from both viruses. Since smallpox was officially eradicated, however, routine smallpox vaccinations for the U.S. general population were stopped in 1972. Because of this, monkeypox has been appearing increasingly in unvaccinated people. Evidence suggests that the smallpox vaccine can help prevent monkeypox infections and decrease the severity of the symptoms. One vaccine known as Imvanemun or Imvanex is licensed in the U.S. to prevent monkeypox and smallpox. Vaccination after exposure to the virus may also help decrease the chances of severe illness. The CDC currently recommends smallpox vaccination only in people who have been or are likely to be exposed to monkeypox. Immunocompromised people are at high risk. So it's better for you to reduce your risk by limiting contact with people who have suspected or confirmed monkeypox. When you are physically close to them, they should wear a medical mask, especially if they are coughing or have lesions in their mouth. You should wear one also. Avoid skin-to-skin contact whenever possible and use disposable gloves if you have any direct contact with lesions. Wear a mask when handling any clothes or bedding if the person cannot do it themselves. Regularly clean your hands with soap and water or an alcohol-based hand rub, especially after contact with the person who is infected, their clothes, bed sheets, towels, and other items or surfaces they have touched or that might have come into contact with their rash or respiratory secretions, for example, utensils, dishes. Wash the person's clothes, towels, and bed sheets, and eating utensils with warm water and detergent. Clean and disinfect any contaminated surfaces and dispose of contaminated waste, for example, dressings, appropriately. So guys, tell me, have you ever seen someone around you with those symptoms? Let us know in the comments. Stay healthy and stay with Health Conscious.